In this video, we are highlighting President Museveni's speech he made on 3rd November 2022 at the National Medical Stores in Wakiso when he was commissioning the warehouse that was built. President Museveni, he said, the local production of drugs and vaccine is cost-effective as far as the improvement of Uganda's health care system is concerned. This was when he was commissioning the warehouse in Kajjansi, Wakiso district. So let's take a look. But don't forget to like, share, and subscribe to this channel. Thank you.
The facility, as you heard, is a good one, and as I saw, it serves part of a portion of the health systems. Because the health systems are linked. There is the acquisition of drugs and storing them well. So this one solves the storing well and in big quantities. However, the government is determined to get out of dependency on the issue of drugs and vaccines. We are now talking of the pathogenic economy. Because these diseases are not only a problem, they are also money makers. So if we are to be sick, let's get money out of our sickness. I was looking at the figures. The global business of pharmaceuticals is 1.4 something trillion dollars. The global business of all this, of the medicines, the vaccines, is 1.4 something trillion dollars. Of that, Africa makes on about 40 billion, 50 billion. This is not good. This is how Africa lags behind all other continents. And here we are going to get out of that. We are doing everything possible to make the drugs here, to invent new ones. The other day we were in Matuga, a town near Kampala, and we were going through the issue of malaria. Apparently there is really no new drug for malaria since 1820, 1800, lukumi lunana abiri. Wate mukitegeera mu luzungu. 1820, when a French doctor stole the knowledge of the Indians in South America who treated him for malaria. And then he asked them what it was, and they showed him the bush, chinkona, and he got quinine out of that bush. This is 1820, and apparently the German doctors, medical doctors, added chloroquine by manipulating something. And the Chinese recently have added artemisinin from another bush in China. Otherwise, no new drugs for malaria. But we have found a new drug here, which you have here, you people. So we are going to produce that drug. It's not, it is a property of your people, of your villagers. They have been using it, but you, the educated people, had not identified it to modernize it. But now one of our people they are working on it. So we are going to go area by area, making many of these drugs here, either in partnership with others or by ourselves. And the vaccines, so that we reduce this huge the import of drugs, but also sell to other African countries and maybe other parts of the world also.
So Museveni has highlighted as Uganda is doing everything possible to make sure that they invent new drugs and stop depending on the whites. And this is done every day. Every day, they are making sure that they get knowledge of doing their own things, as in you build Uganda, buy Uganda, build Uganda. He says no new drug has been invented since 1820, and that drug for malaria has not been invented. So we still have those drugs that were invented long time ago in 1820, and Uganda has recently invented some new drugs and vaccine, and soon they'll be produced here. This will help in lowering the cost of the money spent in buying drugs from outside, and will create jobs for Ugandans.
Now, the other issue is what Kamabare talked about. And you know what Kamabare means? Kamabare means somebody who was born in the rocks, in the rock outcrops. I don't know where. Which Mabare were you born in, Kamabare? What are these? Come and tell me on the microphone.
Your Excellency, I got that name from my father, who was born in a place which has many rocks in Kazo district.
Kazo.
Thank you. Yes.
Kazo, where Kazo?
I don't know the place very well, but it is. I have been there. It has rocks, and that's where he was born.
Which rocks are these?
Your Excellency, the rocks are in late Mosaic Kazaland in Kazo Town Council.
Oh. So you can hear that this is a man born in the rocks. Well, he told you the struggles we're having with the stealing of drugs. Because you call this national medical stores. I think you should change it and call it Great Lakes Medical Stores. Because the drugs here are shared by the whole of the Great Lakes. I hear that when you go to Congo, just over the border, you'll find these drugs there. And you will find them in South Sudan. So that's where all of you, partners and friends, need to work together to solve the other issue of the last mile of the drug. From here to the district, from the districts to the health center, and what happened thereafter, because this is where the big problem is. I know it is Pan-African, I'm a big Pan-Africanist, but I don't think stealing drugs on a Pan-African scale is a good idea. So we must solve this. We must solve this. Of course, our neighbors need those drugs. The people in Congo, the people in South Sudan, they need them. But we need a better system rather than planning for Uganda health centers, and then the drugs end up in the whole of Central Africa. That means nobody will get served. The Ugandans will not be served enough, but even the neighbors will not get enough. So we need really to analyze this whole issue of drug supply during this time of lawlessness in this whole area.
So, national medical stores, warehouses are found in Wakiso district, Kajjansi, but Museveni feels that this should change from national medical stores to Great Lakes medical stores. Why? Because our drugs that are produced here, we Ugandans are not the one who uses them. We have people from Sudan, from DR Congo. You can go to they can go as far as Uganda's border, and you can find Uganda's drugs. Why? Because we are connected, and he doesn't see any reason, any problem with this. But the problem comes from stealing the drugs from these corrupt officials who go and sell drugs from outside countries illegally. And Museveni is saying this should stop. Museveni says we need to work together. The government officials and other partners need to work together to solve this vice of stealing drugs from, he has called it the last mile drugs. This is stealing drugs from the medical stores to the people that are supposed to benefit from it. Because if you sell drugs to the outsiders or to the other pharmacies, the drugs that are supposed to be for free, that means people will not benefit from these drugs that the government supplies.
Secure the ones of Uganda, make sure they go where they are supposed to go, and find a solution for the other areas which have got security problems now. In South Sudan, in Congo, I don't know whether Somalia is part of this effort, whether they are members here. The Central African Republic, all those countries, they are sharing. So that's definitely for Congo, because I have sent my people there. If you just go over the border, you will find the drugs in the health stores in Congo. So otherwise, I think we are doing well. Now there is another one who spoke well about the preventable diseases which should be prevented. One of the speakers touched on it. Because that area has been neglected by the ministry people. They are training. I don't know how they train them in the universities, but they seem to be training in Bachelor of Sicknesses. somebody gets a degree in sicknesses. But I thought you should get a degree in health. And health would include preventing sicknesses and treating the few that are not preventable. That's what the education should be about. But not specialize in allowing people to be sick and encouraging them to be sick, and then you wait for them in the hospital. This is not, this one, it takes a lot of resources unnecessary. And of course you are not short of sicknesses, because the other ones, what you call the non-communicable diseases, are coming up also in Uganda. Because you are getting richer, and now you are getting the disease of richness. Hypertension, what have you, all those are coming up. So, of course, even those ones are also preventable, as you know, many of those. So I'm very happy to be here. I thank all the partners for contributing. But please, the other issue of taking the money away from you and to Minister of Health and then coming back to Minister of Finance, I think that is simple. They should not take away your money. They should keep it here. So that you can use it, but we shall sort it out. It's not a big issue. I think the bigger issues are what we have said. Number one, the Pan-Africanization of these drugs here, which are only meant for Uganda. Two, local manufacture of these medicines and vaccines. And three, public health, stopping many of the preventable diseases from attacking our people. In that way, we shall have a robust and maybe cost-effective health system. I don't know how much expense we go into because of not doing that. How much more expense do we incur? So finally, I congratulate you, but you built it in a bad place. You built in a wetland. And when I asked Kamabale, because he was born in the rocks, he does not know how wetlands look like. He gave me a long story that this was a quarry of clay by Kajjansi tile makers. Yeah, but that's proof. If it is a quarry of clay, that proves it was a swamp. Because clay is always in swamps. I think in the secondary schools we would say QED, proven without question. But you don't have to worry. We have told people who have built structures like this and factories, we give them 10 years to migrate out of the wetlands at their own cost. But I don't know how economic it is. For instance, the amount of money you used to fill up, because this was definitely a swamp. How much money did you use to, what do they call it, backfeeding or what? To fill, to bring soil and put it in the swamp to create farm ground. It must have been quite a bit of money. Who is the builder here? Who built it? Who was the constructor? Is he here?
Your Excellency, it was a design and build. It was built, big structure was built by Complant, the Chinese company.
But are they here?
They are not. They couldn't finish, and we asked them to leave, and we finished it through the subcontractors that I mentioned, Your Excellency.
Who are they?
We have the one, WADA.
Can you estimate for us how much the foundation took, that WADA man? Because of filling up.
Your Excellency, it was a design and build, so all that was in the total cost of the 69 billion. So
yeah, but if you had chosen dry ground rather than swamp, who can give us that breakdown?
Your Excellency, we do not have anybody here to give us that figure.
Or you are hiding him?
I'm not hiding.
You said WADA was there.
WADA came just to finish up these works, the original work and design up to this level.
No, but if he's an engineer, he would know. You come, let me see how you look like.
Yeah.
Oh. So, with these few words, I congratulate everybody. And the structure is commissioned and approved with all the comments taken into account.
Excuse me, Your Excellency, before you speak, we would respectfully like you to officially sign on a document which they are bringing right next to you. And we have 3 special photos. We'd like to ask the Global Fund representative, the Gavi CEO, the US ambassador, the WHO country representative, the UNICEF country director,
from this
and the
video.
Minister of Health.
I think you've had everything. I don't need to add anything. What you should do is to subscribe, like, and comment. Leave a comment and anything that you want to know. Yes, God bless you.